You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, we are looking at attitudes. You got it. That's right. Who's got attitude? This week, we're talking about the attitudes, values, perceptions, and beliefs around rheumatoid arthritis, patients' knowledge, as well as rheumatologists' knowledge. So this is a subject that is very near and dear to my heart. And I don't necessarily just mean rheumatoid arthritis, but I mean how other professionals view the importance of dentistry in the involvement when it comes to looking at systemic diseases. And I'll front load this by just sharing a short story. For many of you know, my sister is a foot and ankle surgeon. She does a lot in the surgery space. She sees a lot of end-stage diabetic patients. By the time they come in and they see her, they are usually complaining of things. We all know by the time somebody with a chronic disease starts complaining of something, it's probably quite involved. And of course, in her case, I always laugh, her patients come to her office as new patients because they notice when they take their socks off at night that there's blood in their socks. My goodness, wouldn't that be amazing if that happened with us in dentistry, wouldn't it? But anyway, my sister sees these end-stage diabetic patients, and she is oftentimes performing quite advanced surgeries, whether that is the debridement or excise of a diabetic foot ulcer, whether that is amputation of a toe, part of the foot, the whole foot, a whole portion of the ankle, below knee amputation. Yes, if you're anything like me, you heard bologna, like the meat that has a first name. It is not bologna like the sausage. It is bologna like they actually amputate directly underneath that kneecap. So she sees patients with advanced diabetes. And a few years ago, she and I constructed a study that was published inside of her medical community in which we asked foot and ankle surgeons, her community, her colleagues, how often when a patient comes in and they have some sort of diabetic display on their foot, and oftentimes I will say patients come in to see her, they don't know that they have a diabetic foot ulcer. They are undiagnosed. So oftentimes when they come in to see her, they are having, a diagnosis immediately following having their diabetic foot ulcer treated. So the question became, as foot and ankle surgeons, how often do you ask your diabetic patients about their dental history? Do you ask them about if they routinely present to the dental practice, if they have, had any periodontal diseases in their mouth, etc.? And my sister admittedly will say there are many times when a patient will come in, they are missing multiple teeth. Sometimes teeth are flapping while they are talking to her, but they're more concerned about their foot at this point. And so we did a research study to identify, and it was quite concerning and alarming, the number of times that medical doctors are treating patients for a chronic disease, and nowhere in either their questionnaire, their medical history, a part of their workup with their patients, or even their referral. So after my sister sees a diabetic foot ulcer and she pretty much knows what it is. I mean, albeit, yes, biopsy has to occur, et cetera, but gosh, she knows what a diabetic foot ulcer looks like. That the next step for her is to move this patient into getting diagnosed by a physician who's qualified to do so. But why is a referral to a dental practitioner, a periodontal practitioner, et cetera, not a part of the regular cadence for treating these patients? You can tell how passionate I am about this, right? So here we are. This research study was just released in April of 2023, and it looks at the working knowledge of patients with rheumatoid arthritis. And basically trying to understand, do these individuals who have RA, and I'll front load this by saying it is well understood that there is a two-way directional or bi-directional link between periodontitis and rheumatoid arthritis, that we have seen periodontal pathogens of oral origin, obviously, inside of the joints of individuals who have RA, and that individuals who have rheumatoid arthritis and have uncontrolled periodontitis will have a higher DAS28 score that stands for Disease Activity Specificity score. So that's where they specifically look at in the 28 joints that are affected in rheumatoid arthritis, how many of them are experiencing overt signs, stages, or symptoms of arthritis. If they have perio, that score is going to be higher, which is just a really fancy, long, complex way. You're like, this is supposed to be a fast fact, Katrina. What are we doing here? It's a long-winded way of saying that if we can control our patients' periodontal conditions, we can potentially reduce the number of pathogens that show up in the joints of individuals with RA. And we can even potentially reduce some of the signs, stages, or symptoms of RA, some of the pain, if we can control periodontitis. So this is important because when we look at how this is actually showing up inside of RA patients, we're actually finding some concerning pieces. So this is a survey that was done of patients with RA. Inside of this study, most RA patients in the study reported experiencing signs of periodontal disease. So in the survey, they reported either bleeding, sore or swollen gums, bad breath, or mobile teeth. Despite the fact that many of these patients revealed that they knew that it was important to keep their teeth and gums clean, the majority of these patients, 79% of them, did not know that if they have gum disease in their mouth, that this is going to impact their rheumatoid arthritis condition. This is where we started to kind of deep dive and want to better understand rheumatologists' behaviors. So these patients who receive a diagnosis of rheumatoid arthritis from their rheumatologist, are they receiving any information from their rheumatologist about the implications of untreated or unaddressed periodontal disease on their arthritic condition? Interestingly enough, only 14% of rheumatologists surveyed report that they always ask their patients about oral hygiene or their oral health status, or perform an oral examination on their patients. Only 14% of rheumatologists participate in a conversation with their patients. We understand that, of course, they did this in the study. 100% of practitioners report that they need to keep up to date with current medical literature. So this is not a new concept, that they need to be practicing the evidence-based modalities that are entering their profession. And yet inside of this, only 14.3% of them are creating an active conversation with their patients. This, my esteemed colleagues, creates a far more critical conversation for us when we see a rheumatoid arthritis patient, that we are not only creating the conversation with that patient, but also perhaps considering some sort of an open conversation and closed loop referral system with the patient's rheumatologist. This could be something as simple as creating a synopsis of your care for your patient on your practice letterhead, handing it to the patient and saying, will you take this form and please hand it to your rheumatologist next time you have an appointment? Or, of course, even better, sending it directly to the rheumatologist with a breakdown of, hello, I am the treating clinician for this patient. Here is their current diagnosis. Here's their current care plan. Here's their current maintenance protocol, etc. And generating this letter every time that you deliver care for this patient. This is an incredible way for dentistry to get involved in this conversation and help leverage the communication that at the current moment, only 14% of our rheumatologists are having around the importance of managing periodontal conditions. Well, thank you. Thank you for being a part of my passionate conversation around leveraging the medical community's conversation around oral health. This is an important dialogue, and it is one that you will hear a lot on Fast Facts Perio Edition. But with this, I'm going to sign off for this week. This has been another episode of Fast Facts Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.